Hello, everyone. My name is Troy Belville. I'm a third-year medical student at Creighton University in Omaha, Nebraska, and I worked on this case report with Chief Resident Dominic Gentile and our attending Dr. Joe. The title of my case report is Unveiling Unusual Hue, a case of green urine in pancreatic cancer. A quick introduction. So we present the case of a 79-year-old male who came to the hospital with known pancreatic cancer. It was complicated by obstruction of both the duodenum and the main pancreatic duct. So this report, it really describes the stent placement that was done for the obstruction, with an emphasis on the very unique postoperative finding of green urine, which is attributed to the methylene blue contrast that was used during the stent procedure. All right. So for the case presentation, we have a 79-year-old male who presented to the hospital with weight loss, intractable nausea, recurrent episodes of upper abdominal pain, and distension. His past medical history is significant for hypertension, chronic kidney disease stage 3, hyperlipidemia, GERD, osteoarthritis, and pancreatic cancer with a duodenal obstruction. And prior to his most recent hospitalization, he had already received 2 gastric stents, 1 duodenal stent, and a biliary drain. On his most recent hospitalization, general surgery and GI were consulted, given the complexity of the pancreatic mass and the size of it. And the mass had grown since his last hospitalization a few weeks prior. Ultimately, a decision was made to replace the current stent and to add both another duodenal stent and a pancreatic duct stent. All total, the patient eventually required 3 duodenal stents within 2 months. As far as labs go, he was slightly hypokalemic at 3.6. His kidney function wasn't great. His BUN was elevated at 41, creatinine elevated at 1.41. As far as CBC, he was anemic, slightly anemic. His hemoglobin was 10.4. His hematocrit was 33.1. His LFTs were normal. He did have an elevated alk phos at 284 and an elevated lipase at 241, which are both indicative of that pancreatic cancer, which is compressing the biliary tree. Okay, so as far as imaging, the CT scan on the left is from August 3rd, which is the day before his duodenal stent replacement on the 4th. So as you can see, the stomach is very distended, proximal to the stent, indicating some sort of obstruction on the current duodenal stent, which is this one right here. And then here's a CT on the right from a couple weeks later. Like I said, the procedure was on the 4th. This is a couple weeks later after the stent was replaced. As you can see, the stomach is much less distended. And clinically, he said he was doing better, less distension, less nausea. He wasn't vomiting anymore. So the procedure was successful. However, the nursing staff did notify us the day after his procedure, his duodenal stent procedure on the 4th, that his urine was green. His urine was collected the morning of the 5th, the morning after the procedure. His overnight urine output was about 250 milliliters of this vibrant green urine, and it was pretty opaque, like it was hard to see through completely. Very vibrant, very unique, something my attending and my resident hadn't seen before in practice. Okay, as far as discussion, so after the 3rd stent, like I said, our nursing staff notified our team about a very curious postoperative finding of that vibrant green urine. And after consulting the LIT and the patient's gastroenterology team, we ultimately determined the methylene blue contrast was very likely responsible for the change in urine color. And typically, methylene blue is used for diagnostic or confirmation purposes, especially with GI procedures, such as identification of fistulas and or proper stent placements, such as in this patient. Methylene blue, it can also be used as a therapeutic agent for the treatment of methemoglobinemia or refractory hypotension. The dye is converted into a leucomethylene blue by GI bacterial flora, and it's mostly excreted in the urine. And although it's a very rare side effect, the green tinged urine, it's ultimately benign in nature. And in our patient, it resolved after about 2 days. So our incidental finding of green urine, which is a result of that methylene blue dye, It serves as a lesson and a reminder of the potential unexpected side effects of clinical procedures, even straightforward procedures like a stent placement. It underscores the importance of individualized patient care, close collaboration with multiple specialties, and also vigilance and attention to recognizing and addressing unusual outcomes, such as in this case. Ultimately, further research and reporting of such cases will continue to expand our understanding of unique presentations, especially oncologically, and their complex management strategies. And that is all I had. Thank you very much for listening, and let me know if you have any questions.